March is Endometriosis Awareness Month, and before anybody asks, yes, I know I'm not the one having periods here, but the reason I care about this is because I've watched people in my life who've had to deal with this. I've had friends growing up who were told that their pain was just a bad period, friends who were missing school, missing work, literally curled up in bed in pain, and they were still being told it was normal. And it turns out, sometimes it's not. At Planned Parenthood, people can come in and talk about symptoms, ask questions, and get connected to sexual and reproductive health care. And that matters because a lot of people are told that extreme period pain is just normal. Missing school, missing work, being curled up in bed from pain during or after sex. People get told that that's just a part of having a period. But sometimes it's something more serious. Endometriosis is a reproductive health condition where tissue similar to the lining of the uterus grows outside of the uterus. That tissue can grow on ovaries, the bowel, or other parts of the pelvic area. I even have friends in my life who were told they were infertile before finding out they had endometriosis. And even though this affects more than 1 in 10 women at reproductive age, as well as trans and non-binary people, it is widely misunderstood and undiagnosed. Part of the reason is stigma around periods. Part of it is people being told to just push through the pain. And part of it is the long history of people's pain not being taken seriously in the medical system. That's why awareness matters. And it's also why access to sexual and reproductive health care is so important. Planned Parenthood health centers provide a wide range of services, including birth control, STI testing and treatment, cancer screenings, pregnancy testing, gender-affirming care, abortion where it's legal, and patient education. Because people deserve access to accurate information, high-quality care, and support when something feels wrong.